Hi, I'm Dr. Ganesh Nagarajan. I head the GI and HPB Oncosurgery Division at the Nanavati Max Institute of Cancer Care. Today, we'll give you, in brief, various terminologies that are used in treating gastric cancer and what they mean, and what is the correct surgery for gastric cancer. Often, patients, when they are diagnosed with gastric cancers, are usually at a loss to understand what is the next step. Many patients with gastric cancer will need chemotherapy first. Few patients can go for surgery upfront, the ones in an early stage. Most patients with gastric cancer are likely to require chemotherapy first, a few cycles of chemo to downsize the disease, and then can go ahead with the final surgery. When it comes to surgery, removal of a part of the stomach or the entire stomach is called a gastrectomy. Gastric means stomach, and gastrectomy means removal of a part of the stomach. It could mean a distal gastrectomy when we remove the later part of the stomach. When we remove the first part of the stomach, it's called a proximal gastrectomy. And when we remove the entire stomach, it's called a total gastrectomy. Only removing the stomach or a part of it is usually not sufficient in treating the cancer completely. What we need to add on is called a D2 lymphadenectomy. So lymphadenectomy means removal of lymph nodes. In gastric cancer, there are various terminologies for the extent of nodes that need to be removed. There are various stations of lymph nodes. So minimum we need to do is to remove 2 stations of lymph nodes that drain that particular cancer. And that is called a D2 gastrectomy. There are, it's a very, very detailed removal of specific lymph nodes in various areas. And a complete D2 lymphadenectomy with a gastrectomy is absolutely mandatory in treating gastric cancer completely. Once the gastrectomy is done and the lymphadenectomy is done, the remaining part of the stomach or the esophagus, which is the food pipe, is joined to a loop of small intestine, and that joint will restore the continuity of the food. Usually, patients after a gastrectomy may face certain issues when it comes to adequacy of food intake, which the treating doctor will explain to you once the surgery is done. The general misconception is that after removing the stomach, how will they eat? Most patients eat well. The quantity of food may have to be a little smaller and more frequent. That would be the only change in lifestyle that one can expect. Otherwise, most patients tolerate this procedure very well, and the outcomes are fairly good after a gastrectomy. Thank you.